Hey there, it's time to take the lead. Trust your voice, know what you need. Let's break it down.
Welcome to Beyond Clinical Walls with your host, Dr. Bayo.
We'll claim your life.
Have you ever left an OB-GYN appointment feeling like you were on a conveyor belt? In and out. See you next year. You waited for weeks for that visit. You had questions and somehow you still walked out without answers. So you go home, open up your phone, and now you're scrolling through social media and you see a TikTok video that's talking about hormones or a Reddit thread telling you just cut out the gluten, or a wellness influencer selling you a $90 supplement package that promises to fix everything, but you still don't have an answer. This is where millions of women are living, dismissed in the exam room, overwhelmed online, and trying to piece together their own healthcare in between. Women's health is one of the most misrepresented areas of medicine on the internet, and one of the areas where women's concerns are most minimized. No one should ever have to feel like when you go in and see your doctor that your concerns, what you're worried about, shouldn't be taken seriously. I'm Dr. Bayo, your health advocate, and I help you navigate the healthcare system. I'm a practicing family medicine physician, and my mission is simple: to help you understand your health and the healthcare system so you can get the care you deserve. Today's guest is someone who is all in with everything I just mentioned, and I am so excited to have her on the show. Dr. Fran is a board-certified OB-GYN practicing in Rochester, New York. She's an amazing physician. She's a mom of 3, and she is all about helping people get the best care possible. You may know her at PagingDrFran on social media. Welcome to the show.
Thank you so much for having me. I'm so excited to be here.
I am so excited to have you. And just for context, we had just a lovely way of connecting. You know, sometimes our days can be so chaotic. And when you can connect with someone and know that their day is just as chaotic, it can make you feel so good. Thank you for that.
It makes you feel seen, right? Someone else is going through it.
It does. All right. First, let's start with some rapid fire questions. Are you game for this?
Let's do it.
Okay. So what's the one thing you wish every woman knew before walking into an OB-GYN appointment?
This is going to seem almost oversimplified, but knowing that there's different types of appointments in your doctor's office is how you're going to get the care that you are wanting. And this is not rapid fire, but what I mean by that is that we have annual well woman appointments and we have problem visits. And if you come to a well woman visit, we're not going to have the time to focus on a problem. We're there for your preventative care. And I think when people realize and are taught the differences, because we are not good about teaching that to our patients, our front desk is not good about telling patients the difference. Once you know what your appointment, what the goals are of that appointment, you get better care.
That is so important. And people don't realize all of the behind the scenes. And that's something that is very important to me. Like, let me help you know what should be available to you, but isn't often talked about. Second question. What's a question patients ask you online that they're often too afraid to ask their own doctor?
Oh, that's a great question. I think the big one when it comes down to preferences in birth and labor and delivery, I think people are very willing to have that conversation online. But interestingly, even though I ask my patients, very few of them bring those preferences to me ahead of time. And I wish that there was more of a conversation about that in the OB office.
What decision do you most often see women talk themselves out of?
I think a lot of the times people who have painful periods or heavy periods talk themselves out of birth control. And I wish we had a different word for that type of medication, right? So hormone control medications, what most people know as birth control, because of that connection of like controlling birth, when this is really a class of medications that we use to help with heavy, painful periods.
I think if we can unlayer that definition, just like you said, when we talk about birth control, that it really is about your hormones, that would be amazing for people, because there's just, as we know, this narrative that's happening right now that's going against birth control. But if you can break it down and understand what exactly do these pills offer and highlight it's the hormonal changes that are happening, that might help people to understand it more and be more willing to understand the benefits of it.
Exactly. I mean, even just the other day, I had a patient where we were discussing her goals of care, and she's like, "Well, I absolutely don't want birth control." I was like, "Well, tell me more about that." And she's like, "Well, had these religious reasons for it from that weren't even her own, that were kind of like given to her." And then once we were able to like walk through that conversation, she's like, "Oh, I didn't realize that this class of medication did something else other than just preventing birth." I was like, "Yes, let's talk about that."
One big thing that I love to highlight is when clinicians can lean into curiosity, which is exactly what you did. Tell me more about it, because that can foster a wonderful conversation to kind of see where that patient is coming from. And to your point, the beliefs or the thoughts that she was coming from weren't even her own, but also it allowed a conversation to happen that might not, if you wouldn't have said that piece. And I think there's power in that.
Exactly. If you don't open up the conversation from both sides, there's no way that I can help you understand like how the medication works or what the indications are. And if you don't open up to me, then I don't know how to guide my education either. And so it really is a two-way street. And I really encourage clinicians to like ask that other question, like you said, keeping it open for conversation without it being adversarial, without like coming at each other, but just being like, tell me more. Like, what are your thoughts on this? And it really opens up the conversation, and you can get to a place where you both are feeling well informed and make decisions together.
Well, that two-way street, and you and I, we learned in medical school, of course, shared decision making, and that's the way it should be. And that two-way street can be challenging. So one thing I often share online is there's a power dynamic that happens. And what happens is a person comes in and all of a sudden they feel very anxious. They might feel just overwhelmed by the sheer walls of the clinic when you're like, okay, I don't feel well. I don't know this doctor. I've never met them before. And then the doctor comes in and there may not be an opportunity to really meet that patient where they are because we're constrained by time limits, all the things that you and I know.
Yeah.
But if we can take even one sentence, like you said, like, tell me more about what's going on and foster that bi-directional, it's amazing how we can actually move that needle when it comes to health.
Yeah, it's really less about checking those boxes at that point and really working towards the common goal of feeling better.
Well, I always like to start with the basics because often, like we just talked about with the patient that you mentioned, there is a curiosity behind what is actually happening when I go see my doctor. I know I'm sitting in there and I'm supposed to have this exam, but what the heck is actually happening? So I want to just start with, what is an annual exam? What you broke down earlier about annual and like a sick visit and other things like that, but what exactly is an annual exam when you see your OB-GYN?
Yeah, so there are several fields of medicine that have these like annual preventative care visits. And so, for example, in the OBGYN world, a lot of people think of this as like their well woman's pap smear visit. In family medicine, these are more your annual physicals. In dermatology, these are your skin checks. And there's very specific things that these appointments are made for. So I'm going to focus on like the OBGYN side since that's my job. The things that we talk about in an annual preventative care well woman's visit, I'm just going to keep like interchanging these words because every office calls them something different. In my office, we call it an annual, which I don't think is the best word for it. We have a checklist of things that are usually put forth by like CMS, Medicaid, Medicare, and that the private insurance companies then take on to say like, these are the things that we will cover for you to keep you healthy. And I think of it, a lot of it's that your doctor should be asking you a lot of questions to make sure that we're screening you for things that could happen down the road. So for me, that is, I go through your menstrual history with you and make sure that I'm screening for like painful or very heavy periods. I talk to you about your sexual health. Who are we exposed to? What are you using for contraception? Do you have plans for family in the near future? Is there a history of STDs? Would you like STD testing today? I go through pap smears. I look at your history of pap smears. I make sure that your current one is either up to date or that we need to do it. We talk about family history. Do you have a family history of cancer? And for me, it's always ovarian, endometrial, breast, or colon cancer, because those are, if there's a strong family history, I'm going to get you to the right testing. And then the preventative care things. Are you eligible for HPV vaccine? Are you eligible for osteoporosis screening? Are you eligible for colonoscopies? Are you eligible for a mammogram? And so that's like the checklist of things that your insurance or Medicaid and Medicare have decided they will cover for you at this visit to keep you healthy lifelong. I may find something as I'm asking these questions that need further workup because it is a problem. So for example, if I'm asking you about your periods and you tell me, my periods have gotten a lot heavier over the last 5 years, or I've always had irregular periods. Now I'm addressing a problem as well. And so when you think about your annual GYN visit that you every year you go to your gynecologist, I highly recommend that if you also have a problem, my periods are now heavy, I want to talk about preconception counseling, I have a strong family history of cancer that I want to get genetic testing for, talk to a genetic counselor. Those don't so much fall into that preventative care that we just talked about. So 2 things to do. 1, you can ask your office if you're able to schedule more time for a problem that day. Some offices may be able to do that. Or if a problem has come up in the last couple of weeks or months, that you make an appointment that day that you are like, oh, I really want to talk to my doctor about that, because you may need a second visit. And I know that is really frustrating to hear because you are already at your doctor's office and you want to take care of the problems. But like you said, we have a limited amount of time in our day. And so if I have a patient scheduled for that annual, I want to make sure I'm dedicating those 15 minutes to their preventative care and giving them their all, because some of that thing is extensive. Like a history of abnormal pap smears takes me some time to work through to know like what I'm supposed to be doing for you that day. If you're eligible for mammograms, I should be asking you a lot of questions to get like a Tyrer-Cusack score to see if you need additional breast imaging on top of just a traditional MRI. And so it's been decided by insurance companies, I have 15 minutes to do that. But on the flip side, if you have a problem that you want addressed, you also deserve that time. And it sucks to have to squeeze all of that into a short amount of time because you want that addressed at that time and your doctor wants to make you happy, but you're really not getting the best care in both situations. Your preventative care is cut short and your time to talk about your problem is cut short, and you leave that appointment not feeling like you had the time to address it. And that's why I talk about it's so important to educate the public on the different types of appointments. And no one educates patients on this. We try, but the call centers or the front desk staff doesn't have the time to say 100 times a day, like, this is the difference in appointments. Like, so no one's teaching patients this. And then patients are frustrated because they didn't get the care they wanted because we didn't tell them how to schedule an appointment appropriately. And how would they know if we hadn't told them?
I couldn't agree more. The conversations that I often have with my patients or online, it's, how can I share those tips in hopes that you can navigate those barriers that are in place that unfortunately we are beholden to, whether it's the insurance, whether it's the hospital system. So the majority of my audience are, people who have been dismissed or gaslit, and they are trying to work up the courage to see their OB-GYN. And what would you say to that woman who has been struggling with period pain and she's getting ready to see her OB-GYN for the first time? What would you say to her to prep for her appointment?
Yeah, I think that's a really great question. So I think first, like we said, scheduling a problem visit to talk about it. 2, bring in a support person if that makes you feel more secure. If you feel like having another person to be like, yes, actually, she calls off from work every single month on the first day of her period, to really, like, again, be a support. I think having support in any medical encounter is so important. And that's why, we're supportive of doulas in the obstetrical world, because like more support is better, right? If you are someone who likes to have someone there with you, I highly encourage you to bring someone with you. If you have a recurrent problem, but that's like periodic, so say like your periods are abnormal, coming in with some information for me to like use is very helpful. So if you're like, I've had irregular periods my whole life, if you come in and can tell me like how your periods have been, so I can see like, oh, you're right, they happen every 42 days and that is irregular. And now I have this data in front of me that can help me decide where I'm supposed to go as a physician, that can be very helpful. And I think sometimes a lot of things are related, but sometimes they're not. And so if you have a period problem, but also have a PMDD problem, sometimes those can be worked on together, but sometimes they deserve separate conversations. And so at the beginning of the appointment, you can say like, I have two really big concerns today. My periods are really heavy and I'm concerned I have PMDD. And that way your physician can kind of know like, where can we guide this conversation? And can we kind of do 2 for 1? Or are these conversations so big that we need to focus on? And then I know, listen, I really think that the conversation of PMDD deserves a second appointment. Let's focus on making your painful periods better or doing the workup for that. And then we'll have another time to focus on the PMDD. I also ask my patients, like, which one of these two do you want to focus on today so that we can really tackle your biggest problem and then focus on the next one. I think having that in the beginning of the appointment about my goals, right? My goals today are to address my painful periods, but I would also like to talk about my PMDD. It just puts a reference for your doctor to know how to guide the conversation and for you to know like what we can and cannot address in the time that we have. For many of us, we know like if someone comes in and they want to talk about PCOS, I know that that conversation for me is going to take about 20 minutes. And so I can't have a comprehensive conversation about all the different ways of managing PCOS as well as PMDD that day. And so I want to ask you what is most important to you today and what can we focus on another time. And so I think all those things set you up for success in a way where it keeps you working towards your goal of feeling better and being a team with your doctor.
And that part is important, feeling like you are working towards a goal. A lot of times I'll hear online or through my patients where maybe they saw a specialist, maybe they saw another primary care doctor, and this feeling of defeat, like, I don't even know what we're doing. I don't know what we're working towards. And so if you can, memorialize or write that down about what are the 2 things, I want you to write down the top 2 things that are important to you. And I love how you brought forward the fact that, as doctors, we know when someone says these certain symptoms, we kind of have an idea of how long it's going to take us to get through that. And then we were thinking about our 15 minutes. And so if we can bring those 2 together with what the patient has said is most important, and then as a doctor, you've set us up for success to help you, it's a real way to help that patient kind of move that needle towards a diagnosis or whatever treatment plan that we're hoping for.
Yeah, exactly. I mean, I feel bad too because it's in a way putting it on the patient, and I would hate to do that. And sometimes when you have a long-standing relationship with your doctor, that's not always the case. But especially if it's someone who's new to you, if you guys don't have an established relationship yet, sometimes it is knowing about like, okay, my biggest goal is this, and I need to emphasize that to my doctor early on so that they know how to work through this problem visit today.
We talked about period pain and different things that are happening when it comes to women's health overall. It leads me to IUDs and pain management, not even just limited to IUDs. So let's talk about what your thoughts are, the current climate towards how we are addressing women's pain.
Yeah. So I graduated from my residency in 2021, and we were not taught about pain management during an IUD insertion or endometrial biopsies or colposcopies. I remember having like a visceral reaction when I was supposed to do my first colposcopy, which is where I take a little biopsy off of someone's cervix, because when you think about it, it feels like that would hurt. And my attendings were like, oh no, the cervix doesn't have nerve endings. I was like, oh, okay. I didn't realize that. That's interesting. And the thing is with all GYN procedures is that the people experience them in such a spectrum. So any one of us who were to have like a punch biopsy taken out of our forearm skin would feel that similarly. But the cervix, very interestingly, is innervated differently for people. And I can't always explain it. I have like some theories. I think that vaginal birth does somehow stun those nerves for some time. But everyone, and even people who haven't had birth, some people feel it and some people feel nothing. And I can't explain why that is. But what it made me realize that when I went out on my own in 2021, I was on TikTok scrolling and there was other OBGYNs talking about pain management during an IUD insertion. And I was like, oh, this is what was missing in my training. No one taught me this. And so I really learned from other doctors talking about it on TikTok. And then when I started working, I was like, this is what I'm doing, because that doctor on TikTok like set me up for success to tell me how to do this. And so since I've been in attending, I offer pain management options to all of my patients, and I have since 2021. And for me, that looks like I really prefer to see a patient prior to doing this procedure. I very rarely will do a procedure for someone that same day because I don't feel that they've like we haven't been set up for success. I ask everyone to take ibuprofen because that does help with the cramping of a uterus. So this is not like you only get ibuprofen, but ibuprofen is an important part of the management plan. If you have a ride, I'll give you an Ativan. If you have anxiety about having a procedure done, during the procedure, I'll offer a paracervical block, which is a needle that goes into the vaginal tissue around the cervix. It is a needle. There will be a sting and a burn from a needle and lidocaine, but it can help. I also offer a couple narcotics for after because the cramping for the next couple days can be significant. And I've had patients who were like, I decline all of that. I want to go to the operating room. I said, see you there. And so I have always been since I've been attending on the side of managing pain, and my patients appreciate that is acknowledged. And not everyone takes me up on all parts of it. And I would say almost no one takes me up on all of it, but they pick and choose what's right for them. And I'm very grateful that the conversations online have changed how we provide patient care, that we've been more aware really of the patient experience and how much patients weren't appropriately treated prior to the guidelines coming out from ACOG in 2020. I believe is when they were finally published by ACOG, because that was the big sticking point for many people, is that we didn't have any good recommendations, and there's not just one treatment plan that offers pain-free experience for every single person. But I think what the ACOG guidelines gave us was at least some framework and some things that like everyone can offer in their offices. And really, I think big strides have been made in the last couple of years to try to understand that everyone experiences these procedures in different ways, and that we really need to be cognizant of that and have a patient-centered approach when it comes to patient pain management.
We do, and I want to unpack all the wonderful gems that you put out there.
That was a lot.
And I loved every bit of it. And I want to highlight it because, first I want to just start with, you shared how you give your patients options. You share all of the options. So for the person listening right now, I've shared in the past certain tips that you can use when you see your doctor, just to make sure that you know all of your choices. How do you deliver those choices to your patients? So maybe whoever's listening right now can use that, and when they're, getting ready for their appointment.
Yeah. So if your OBGYN is talking to you about doing IUD insertion, endometrial biopsy, colposcopy, I think it's really important for you to say, like, what are my pain management options? That's usually when I then go into my spiel where I say, okay, I can do the Ativan, I can do a paracervical block. This is an oxycodone I can give you for after, because asking them puts them in a place where they have to give you an answer that you're looking for, right? I assume that you would like to have pain management if you're asking for it. So if someone's like, oh, I don't do any of that, right? Like, you don't need that. You know your body better. And you're like, no, I do need a paracervical block. I actually do know I need that. Gives you the opportunity to find someone else, right? Because if your doctor's not willing to do the thing that you really want for yourself, like, it's the standard of care now. So it's okay to find a doctor who will follow that standard of care to offer you your options. But I have the same spiel. I tell my patients all the same things every time. But if your doctor isn't starting that conversation, I do highly encourage you asking about that. And that's why I think it's also important to have that kind of appointment before you just sign up for an IUD insertion. Like, you can ask to have an appointment to discuss pain management. You can have an appointment to talk about what an endometrial biopsy looks like for you, rather than just having to make an appointment and show up and, like, kind of like raw dog it without any prior setup for success.
And a lot of people aren't aware that when you show up, that can be more of an exploratory, a conversation about what your interests are. There is no commitment to having a procedure on the same day. And
Exactly.
people are often, when I talked about that power dynamic, well, I don't want to waste my doctor's time. I don't want to, I'm already here. And I also want to be thoughtful that sometimes it can also be a copay. It can be a financial thing that
Yes.
also plays a role. And so first, being able to call, like we talked about, as far as like figuring out what options are available for appointments. And then sometimes just being very open. Like, I have this one visit and I have a lot of questions, and I know I may not be able to afford a second copay. What can we do? Because a lot of times people aren't aware that if you share and you're open, I know I've done that with my patients. If they tell me, sometimes you can work things out.
Yeah, exactly. I also think it's worth asking, like, the front desk when you call, like, can I do this as a telehealth appointment? Can I see someone else to talk about it? I think there's several ways. And like even at an annual, if we do end up talking about that could be a part of that visit as well. So I think there's definitely ways. And, it's very unfortunate that our insurance and the healthcare systems that we have here dictate that part, that our patients have to think about copays. Like I find nothing more disappointing than that in the healthcare system, that patients have to think so much about the money rather than the healthcare that they're receiving, because that's not a problem literally anywhere else.
I had a patient yesterday, a 19-year-old, who asked me how much would it cost for her to have STI testing. And that broke my heart because
Yeah.
she needed it. And she was like, well, I need to know the exact amount. And if we did empiric treatment, meaning for those who are listening, for gonorrhea and chlamydia, she needed to know how much that would cost as well. And insurance really dictates a lot of our care versus us just being able to help our patients right then and there.
Yeah, it's really, really unfortunate because, my sister lives in Germany now, and she also gave birth in Germany, which is interesting because she gave birth here and in Germany. And it's just the experiences are so different, and there's struggles there too, of course. And they have time limitations too. They don't just have appointments that are hour longs and you can just like discuss whatever you want. Like time constraints are time constraints here or in Europe, but the money factor is removed. And I think that makes such a huge difference in like the experience with encountering the healthcare system.
Are there any tips or tricks that you have been able to share with your patients who may be in that financial or a situation where they can only afford that one copay that
Yeah.
someone listening right now could use?
I mean, I think maybe bringing it up at the beginning of the appointment is going to be helpful. Like you said, if a patient said to me, like, I'm in this financial situation where I can only afford this thing, I'm going to tailor that appointment and really focus on like what's most important at that point. So if that is you, if that is going to impact your life so dramatically and financially, like it's hard to be financially vulnerable like that with someone, right? To be like, I can only afford this, but I don't know that if you didn't tell me, right? I will try to tailor how I see you and in what ways I can see you and how those charges happen if I know that, listen, I can only get you in this office this one time. So we'll do what we can.
And the other thing that you mentioned was being able to have that information on TikTok to talk about the ACOG guidelines, all the things that are happening. You and I have experienced where sometimes we get pushback from other clinicians who don't even understand why we would be on social media, why we would be putting this information out there. And that leads me to one of the amazing resources that you have created when there was a time, and it's still happening right now, where the ability to find a clinician that could offer sterilization or whatever you want for your health. I just want to amplify this. Can you share where
Yeah.
that came from? And
Yeah.
I just want more people to know.
Yeah, I had just become a new attending and I had a patient come see me in the office and she was like in her 30s, had never had children. And she goes, I want to be sterilized. I was like, okay, sounds good. Let's go through the risk benefits alternatives. And then she goes, that's it? I was like, yeah, what do you mean? Like, what else do you want to talk about? And she goes, oh, well, you're the fourth doctor I've talked to about this. I was like, about this? Like, what do you mean? She's like, yeah, it's really hard to get sterilized. And I had not experienced that in my own training. My attendings had been like very pro, like everyone makes their own choices for themselves. And so I didn't know that this was such a problem. She's like, yeah, I actually was looking on this Reddit page for people who wanted to be sterilized and you're not on there. So you should be on there. I was like, oh, I had no idea this existed. So I went on Reddit and I'm not a Redditor. So I had a hard time getting on this website to find out how do I submit myself to this like document. And so I like had that in the back of my mind. And then when the Dobbs decision was leaked, right, about Roe versus Wade being overturned, I'm in a private Facebook group of like 5,000 OBGYN moms. And we were talking about this and someone's like, well, if you're willing to sterilize young child-free patients, like put your name in this list. I was like, oh, okay, let me just put myself in this list. And then I was like making videos on TikTok and I was like, oh, I should make a video on how to educate people how to get an appointment to get sterilized. So I was like, hey, if you want to get sterilized, here's what you should do. 1, you should make a problem visit with your OBGYN to talk about it. 2, you should talk to them about what your desires are, like that you don't want children or that you're done having children, your family's complete. 3, you should listen to the risk benefits alternatives that your surgeon should tell you. And 4, if your doctor is not willing to do this for you, let me know where you live and I will tell you a doctor to go to, because I was going to reference this list. So for the next like weeks at a time, I was like, someone would be like, I'm Chelsea from Cleveland. I need a doctor. So I would go to that Facebook group and type in Cleveland and I would be like, oh, Dr. Sophie at Metro will do this for you. You should go see them. And so I was like, okay, this is like a lot of work. How do I get this list on Facebook to be in a public place where patients can do this work themselves? And so I asked the women in this Facebook group, like, is anyone willing to be on a public list? So 150 women submitted themselves, and I made a video and I posted it the day that the jobs decision was made final, saying, if you're young, I like made this like funny video where I was like standing at a scrub sink pretending to like scrub in the surgery, right? I think that was like a big thing that made this video go so viral. But if you're young, child-free, looking to be sterilized, I have a list of 150 doctors in my profile who will help you out. This video went very viral. And in the next year, I spent, hundreds of hours probably compiling this list. It now has 3,000 doctors across the United States who will sterilize young child-free patients who like go into this very well informed, knowing that this is what they want. I continue to work on it. I've hired my little sister to like work on it periodically because I just didn't have the time to continue to update it. But yeah, it really has become a resource. And as you know, like providing a resource that like patients desperately want is such a thing that our patients are wanting. They want this resource. Patients don't want to go to 4 consults to find a doctor who will do something for them, something that is supported by ACOG. We've come to a place where we really should be respecting our patients' like bodily autonomy and knowing what's right for them. So it's I sometimes like forget about it, to be honest with you, but it was such a huge part of, especially the beginning parts of my social media life. It was like inventing or, creating this easy to access list. And I never want to take away from like the child-free Reddit forum, because that's also a wonderful resource. This was just something that I wanted to create to make it easy and accessible. And I'm really happy and proud of the work that we've done.
As you should be. It's beautiful. And
Yeah.
as a Black woman, I want to add to another layer of why I love what you've done, because as a woman with many identities, and that being of my skin color, I often face additional challenges. And I know when I'm saying this, someone listening right now will feel heard and seen. And to be able to have a decision that you want to do for your own body and be able to fast track it and be able to know where to go, that is a real way of helping people in that moment. Because we talk about the barriers in healthcare, but there's so many of us who are wearing additional layers, different identities that make it even harder for us to get care.
Yeah, absolutely. And I think the thing that, a lot of patients have said to me about this list is like, well, I didn't even know I wanted to be sterilized, but I know that this person will listen to me. Right. And like you're saying, like as a Black woman, you're to have to fight to find someone who will listen to you is such a disheartening part of accessing care, right? So a lot of people have said like, well, I didn't need this, but I knew that this doctor would listen to me. And so it's just been so nice to know that in some other ways I was able to help people just find an OBGYN that they like, even if it wasn't for sterilization.
Well, and that form of healthcare, and when we talk about being accessible, helping people online or in the clinic, you have now created a resource that goes beyond that, which is that full circle. So well done. Well done.
Thank you, friend. No, I'm
So
really
proud of you.
Thank you. I'm really happy how much this has been able to help people and find people that they trust with their bodies. And I know, my field is not perfect. We have a lot to answer for historically and today. And if in some ways I can make it easier to find an OBGYN who you feel safe with, like that's just is like all I want out of my social media life and my real life as a physician.
Next question is, for that woman listening right now, we've now armed her with so many different things of what she can do. And let's say she has found this doctor, she has her priority list, she has the right appointment. She's in that exam room, she's talking to that doctor, and she's getting pushback. She's feeling dismissed. What would you say to her as she's in front of that OB-GYN? What can she do in that moment?
Yeah, I think a couple questions you can ask them is, if you are working through a problem where it's undiagnosed, you're having heavy periods or pelvic pain or whatever, you can ask your doctor, like, what is a list of things that this could be? And why do you think it's not? One, we as physicians, work through these algorithms in our brains. And so we have a working diagnosis list in our heads, but we're not always the best about like verbalizing it to our patient, right? So thinking like, okay, could it be fibroids? Could it be adenomyosis? Could this be endometriosis? Is this pelvic congestion pain? We're working through this, and we've kind of, we start to like check them off in our heads, but we don't always like verbalize that to the patient. So if you feel like you're not getting a diagnosis or something clear, asking like, what is on the list of things that could be causing this, and why? How do we check those off? Is it an ultrasound? Do I need blood work? Do I have to see a pelvic floor physical therapist? Like, how do we make sure it's not these things? Second, I would ask them, if you don't think it's that, what is the worst case situation that this could be, and how do we rule that out? Could my heavy new bleeding be cancer? And how do you know it's not? And how do we make sure it's not? Right. So for me, that would be like, well, we should do an endometrial biopsy if you were concerned that this is what that is. It's a way to like make your doctor verbalize kind of like what's going on in their head. And it may be also a way for them to like hear what your biggest concerns are and have to like readdress them in a new different way, that maybe they were starting to go down one track and realize like, oh, actually, I don't really think it's endometriosis because the symptoms don't make sense. But what you're discussing could be a little bit more like PCOS, because your periods are so irregular that when you do get them, they're heavy and painful. And so asking kind of like, what's the worst case scenario? What do you think it's not, and why? And what are the next steps to figuring it out? Again, kind of like brings your doctor back to like what your goals are. Even if you didn't say like, my goal is to get a diagnosis, it does bring you back to that conversation of having your doctor have to verbalize what they're thinking and why or why not something applies to you.
That's exactly what I share online as well, because I call it the running list or that mental list. And I share, have that doctor say what they're ruling in and what they're ruling out. And that allows you to be a part of your own health journey. And if you are facing dismissal, sometimes that dismissal, and you tell me if you agree or disagree, isn't always of malice. It may be that they just missed the mark. And I give an example where we've all had friendships where you feel like you're on the same page as far as whatever topic you're talking about, or maybe that friend was supposed to support you for an event and something happened and you took it one way, your friend's taking it the other way, and we're not in the middle. And so that can happen even in the exam room, and not blaming, a patient or a doctor, but we've all had those types of moments. And so if you can have a way to get everybody back on the same page, it's a win-win for your own health.
Exactly. Yeah. It's just another way to bring you back together as a team rather than kind of being like two separate things. It's like, tell me what you're thinking about me so I know and I can hear that. Or if you've thought like, maybe I do have endometriosis, you can be like, I have thought about maybe this is endometriosis. How do we rule that in or rule that out? At least, and I love when patients come in and think like, I think I might have this. I'm like, great, let's like work through that algorithm. So one, I'm acknowledging you as a participant in your care, but two, that you're getting the workup for this. When I have patients who come in and say like, I think I have endometriosis, we talk about like, well, to absolutely diagnose you, this involves surgery. Are you interested in surgery? Let's talk about that. Or if you're like, no, I really actually don't want surgery, but I do want to feel better, then that's a different conversation. And so if you've thought about what you think it could be, I think it's very reasonable to say to your doctor, like, I think it's this. Like, what do you think?
So my last question is, what is the one thing that a woman listening right now can do to take charge of her own health care?
Yeah, I think the most important thing lifelong would be making sure you stay up on your preventative care. The things that we talk about in an annual exam may seem kind of like boring, but the reality is that breast cancer is going to affect 1 in 8 of us, and cervical cancer, luckily, less so, but only if we go for our pap smears. And colon cancer is now the number one cause of cancer related deaths in my generation. Like, I'm a firm millennial. If you don't go for your preventative care, we miss those screening opportunities. And those are the things that kill a lot of us. And so, as boring as it is, and as tedious it might be to go what seems like a very boring appointment because you feel like you maybe didn't get a lot out of it, the reality is that those are the things that are going to keep you alive lifelong.
And although I said that that was the last question, I fibbed. One more question.
One more.
You have started an amazing podcast of, do your own research. And this
Yeah.
leads me to, there's so much information online and it could be hard to weed through, which are very uncharted waters, I think.
Yes,
it's the best way
very.
to describe
Yes.
it. So how would someone go about finding that credible information? Give me 3 things that someone could lean into, and let's say 3, and then the 4th one will be your podcast. But
Yeah.
I'd like to know about 3 things on top of that
Yeah.
that someone could do to find that credible, clinician.
Yeah. So when you're seeing a video online, the first thing you're going to think about is who is making this video, and they should make that very clear to you about who they are. It's hard because there are a lot of like made up titles that people can give themselves, but what we know, if you're an MD or a DO, that means you are a physician who went to medical school. And a lot of us will then say like what our career is. So like mine says I'm a board certified OBGYN, and that means something, right? That means I went to 4 years of medical school, 4 years of residency. I took a very hard exams to become board certified, and that means something. So if someone's not being like super straightforward with like what their degree is, like that, it should be like a red flag. Like I may not trust that person. The second is if they reference studies or papers that they don't show you or tell you, right? So like if someone says like, oh, well, there was a study that birth control causes hypothyroidism, because I've seen many non-physicians make that video. If you actually look up if I had to go find the study that they were referencing, they didn't like present it to me. And like in my videos, I always make a point to like post the study behind me, and I point to things in the study, and I like show you where you can find this article so you can read it yourself. If someone just is like quoting a study at you and not giving you that information, like that's also a red flag, because they should be using high quality studies, most often in like a meta-analysis, a Cochrane review from their like society guidelines telling you something. So if they're just like spouting like what often sounds like a little fear-mongery, like that should be another red flag. And the third really is if they seem to have like a broad scope of things that usually are fairly niche down. So like there's a lot of people who talk about hormones and rheumatology and other joints and also gut flora. And like the reality is like those are OBGYNs, GI, rheumatology. Those all went into all those things. And this is different than family medicine because my husband's a family medicine doctor, right? That is its own specialty in a different way.
Thank you for saying
right?
that.
You are
a specialty.
You are a specialty in your own way. Primary care is not just like a referral basis. Managing people through primary care is a very specialized job to do. It's not just like managing chronic hypertension with one medication. It is long-term follow-up after you're in the hospital. It is complex condition management that many of us are not at all trained in at all. Like I tell my husband this all the time. So I'm not saying family medicine. I'm talking about chiropractors who are trying to sell you the Dutch test and a GI mapping test and a mold test, and then also sell you the red light therapy, right? All those things, like there are so many smart doctors online now, like physicians, PAs, midwives, people who have extensive training. And those people who have that training are going to be very clear about their credentials. They're going to be very clear about where they're telling you this information. And they're going to be niche down and talking about what they're like trained in. I will never talk about essential hypertension management outside of pregnancy. Why would I do that? That is your expertise. That is not mine. But I will tell you about managing anemia in pregnancy, and I'll tell you about preeclampsia because that is what I've been trained in, and that's what I'm board certified in. And so if people are trying to like pretend that they're experts in everything, like that's another like red flag for me. So those are my 3.
Love it. That is very helpful because what we're experiencing right now, meaning that person who is scrolling through their social media and finding this one person who says the word doctor or that they are an expert. What does that mean anymore?
Yeah.
And so being able to have a definition of what actually a doctor is and where you went to medical school, are you board certified? I'm just going to repeat all of those things are really important. And also I have to say, have you actually seen patients? Have you practiced medicine as a physician? Because that matters.
Yes, it does.
How we're able to really be experts in our craft.
Yes. I think, for the majority of us online, and I really actually I can't think of any doctor, any physicians like MDs, DOs who are not practicing in some way anymore. I think even like today I was looking at Dr. Mike's stuff on, like, someone posted, he's like the most followed physician in the world. And he is. And you know what? He still works clinically. Not a lot, not full time like the majority of us, but he's still working in some way in family medicine. And that's important. And like all the other big people that you follow, I had Dr. Beachgem on my podcast. She works full time and she has 9 million followers. Jen Hamilton also was on my podcast recently. It still works as a labor and delivery nurse with millions and millions of followers. And so I think any of us, if we quit working completely, our word wouldn't matter as much because we are not like on the ground in the office on labor and delivery, doing the work day in, day out and living and breathing the medicine that we talk about.
That credibility is so important.
Absolutely.
All right. Well, before we go, if you hear nothing else, I just want you to, of course, you should already be following Dr. Fran, but if you haven't, please follow her. And is there anything that you would like to end with? Of course, we're going to put in the show notes every single place that people can find you.
Yeah. I think, your doctor really wants to be on your healthcare team. And if you haven't found that right person with you, there are other doctors out there and you really deserve someone who's on your team and who will listen to you. And I really hope that the tips that you find here are the ways that you will find that person and really get the care that you deserve.
I love that. So you can find Dr. Fran on every platform at PagingDrFran and her podcast, I Did My Own Research. It's all about tackling medical misinformation online. And if you've ever gone down that rabbit hole looking for health answers, this show is for you. And the links will be in my show notes. So did something in this episode click for you? Share it with someone who needs to hear it. Every episode is in mind with a woman who has been dismissed, gaslit, looking for answers on how she can navigate the healthcare system. As we close, I just want to say thank you so much for your time, your energy, and your expertise.
Yay, that was so great.
Thanks for listening to Beyond Clinical Walls. If you learned something new today, please leave us a review on Apple Podcasts or Spotify. It really helps us reach more people who could benefit from these insights too. Hit subscribe so you never miss an episode. We've got amazing content coming, including great episodes with the health creators you love.
You've heard the truth, now take the lead. Stand for yourself, know what you need. One step closer, you've made your mark. Keep showing up and light the spark.